There's a type of pain that many people dismiss at first. It shows up in the morning, sharp, almost stabbing, right under the heel, or after sitting for a while when you stand up and take those first few steps. At first, it feels temporary, something that will go away on its own. But for many people, it doesn't. It lingers, it returns, and slowly it begins to affect how you walk, move, even how you live. This pathology, besides being very annoying, could be extremely painful to bear. This is plantar fasciitis, and while it can be persistent, the body often has the ability to recover when you understand what's really happening beneath the surface. Deep inside your foot, there's a thick band of tissue called the plantar fascia. It runs from your heel to your toes, supporting the arch of your foot and helping you move efficiently with every step. But when this tissue is placed under repeated stress through walking, standing, running, or even poor footwear, it begins to develop tiny micro-injuries. Over time, these small strains accumulate. The tissue becomes irritated, sometimes degenerative, rather than simply inflamed. And this is when pain begins to appear. For many people, the pain is worst in the morning or after rest because the fascia tightens while inactive, then suddenly stretches again when you step down. In this case, the use of bandages and/or creams does not really improve the situation, as the pain still keeps on persisting. So in this particular case, what should be done? What's important to understand is that plantar fasciitis is rarely caused by a single factor. It's often the result of multiple small stresses building up over time. Long periods of standing, tight calf muscles, lack of flexibility, excess body weight, or shoes that don't properly support your arch. Even something as simple as suddenly increasing your activity level can trigger it. But here's where things begin to shift. Because despite how painful it can feel, most cases respond well to natural, non-invasive approaches. In fact, clinical guidelines consistently recommend conservative treatments first, including stretching, massage, and movement correction. The goal isn't just to reduce pain, it's to restore how your foot functions. One of the most effective starting points is stretching, because in many cases, the real tension doesn't just come from the foot, it comes from higher up. The calf muscles, particularly the gastrocnemius and soleus, connect into the Achilles tendon, which in turn connects to the plantar fascia. When these muscles are tight, they increase strain on the bottom of the foot. A simple stretch can make a significant difference. Stand facing a wall, place one foot behind the other, keep your back heel flat on the ground, and gently lean forward. You should feel a stretch along the calf and into the foot. Hold for 20 to 30 seconds and repeat several times. A similar variation involves slightly bending the back knee, which targets a deeper muscle layer and reduces tension more effectively. These types of stretches have been shown to reduce pain over time when performed consistently. Beyond stretching, strengthening the foot itself is just as important. Because your foot isn't just a passive structure, it contains small muscles that support the arch and absorb impact. When these muscles are weak, the plantar fascia takes on more load than it should. Simple exercises can help restore that balance. For example, curling a towel with your toes, lifting the arch of your foot while keeping toes on the ground, slowly raising onto your toes and lowering back down. These movements may seem small, but over time, they help rebuild stability and reduce strain. Just apply yourself in order to believe. Then there's something even more immediate: massage. Massage works by increasing blood flow, loosening tight tissue, and helping break down adhesions that can form as the fascia heals. And the best part is, it can be done at home. You can begin with your hands. Gently press along the arch of your foot, moving from the heel toward the toes. Use your thumbs to apply slow, controlled pressure. You can also roll your foot over a simple object like a tennis ball or a bottle. Move slowly, allowing the pressure to reach deeper into the tissue. Even a few minutes, repeated daily, can begin to improve flexibility and reduce discomfort. But it's important to approach massage with awareness. Some discomfort is normal, but sharp or intense pain is not. The goal is to release tension, not aggravate the tissue further. Another key element in recovery is rest and load management. This doesn't mean complete inactivity, but it does mean reducing movements that continuously irritate the fascia. High-impact activities like running or jumping may need to be temporarily reduced. Instead, focus on low-impact movement, allowing the tissue time to recover while still maintaining circulation. Footwear also plays a quiet but powerful role. Shoes that lack support or walking barefoot on hard surfaces can increase stress on the plantar fascia. Providing proper support helps distribute pressure more evenly across the foot. There are also additional natural approaches that may support recovery. Techniques such as taping the foot can temporarily reduce strain. Gentle heat or alternating hot and cold therapy may help relax surrounding muscles. And in some cases, therapies like acupuncture or manual therapy have shown potential benefits when combined with other treatments. But perhaps the most important thing to understand is this: healing from plantar fasciitis is rarely instant. It's a gradual process. For many people, improvement happens over weeks or even months with consistent care. So be patient and do not rush things. Your body is constantly adapting. When you reduce strain, improve flexibility, strengthen support, and encourage circulation, you're not just managing pain, you're addressing the cause. Persistency in carrying out the required exercises and a strong willpower is essential. And that's where real recovery begins. If you found this helpful, consider subscribing for more insights into natural health and recovery. Because lasting well-being isn't about quick fixes, it's about understanding your body and supporting it step by step.